Quarantine can be kind of tough, especially when we're really not sure when it ends, right? Our medical expert, Dr. Cedrek McFadden, is joining us today to focus in on this mental health issue during COVID-19 and the pandemic. And we want to start off with this. What can people do who have stress and anxiety issues on a normal day now in the middle of this?
It's very common to have stress and anxiety with the news that we're hearing, particularly the folks who already have underlying emotional distress or anxiety. For example, people with OCD or obsessive compulsive disorder, they're going to have a hard time with excessive washing of the hands. And how do you manage that? And I think the first thing that you can do is to be self-aware and to recognize how you're feeling so that you can better cope with and look for management options in dealing with that. Even if you don't have control over everything, there may be some things that you do have control over.
And balancing information gathering and needing to stay up to date with sanity is kind of important.
It is a balance. We need to have the information, but too much can be overwhelming. We live in a cycle of 24/7 news, both online and on television. One of the recommendations is that you limit the amount of television and the news that you take in. Perhaps consider 2 to 3 15-minute blocks in the day where you take it in and then you back away from that. That may be one way in which you can limit it, but also keeping in track with healthy eating, going to sleep, waking up the same time, having the routine and not forgetting about your social, your religious, your community groups that provide that needed support during this time.
So many of us are worried about the kids, right? We wonder, are the children handling it okay? How do we judge that, and what do we need to be doing for our children right now?
So children and teens don't always respond the same way we do. In fact, in part, they take cues from us, meaning if we are panicked, if we're worried, if we're just overly consumed, they may take some of that as they build a framework around their response. So number one, let's monitor what we're projecting and present a plan that's prepared. Additionally to that, children may present with irritability. They may present with excessive crying. Maybe their sleep habits or their eating habits are different. Those are going to be signs that something's different and they're perhaps not coping in the same way that they were before.
And you fix it how?
Well, number one, by patterning that behavior and having open dialogue. Number three is recognizing when we need to seek help.
Okay.
And we talk about the therapists, the counselors, and how they're available in other ways that may be helpful in helping children. But I think the first thing is having open, honest dialogue about that and patterning that behavior.
And what about people that have established mental health diagnoses? What do they need to keep in mind during this difficult time?
So many appointments are being canceled, and I think the answer to that is partly dependent on how long you've had a diagnosis and what that relationship is like. So if you've had a diagnosis over 20 years, you're stable on medications or your counseling sessions, you may not need to be in the same pattern as someone who has new symptoms or worsening symptoms. If you're on medications, you need to stay on those medications. Now is not the time to go rogue and to experiment without not having those particular treatments, because this tends to bring out sometimes the worst in some of those situations.
And so ultimately, taking deep breaths and taking a breather from the constant information flow right now really would help people to overall handle this better.
I think it helps you connect with how you're feeling. Are you stressed? Do you have anxiety? And then next, it does help you center and relax a little bit as you take in some of that information.
All right, we appreciate it, Dr. C. Dr. C will be with us live at 5, taking your questions, and we have a spot on the 7 News Facebook page right now where you can add your medical questions to the list, and we'll be taking a look at those and deciding what we will tackle live at 5, but he'll be with us in the next hour. Thank you, sir.
Thank you.